Hey guys, welcome back to the Daily Prime. Just wanted to hop on real quick to discuss the question I get that's popping up a lot from my clients who are having low back pain, and it's simple but confusing and maybe often misleading. But people want to know, should they be using ice or heat to help out with their low back pain? So it's important to you guys that you guys know that 95% of the time, or even higher, it's actually coming between your L5 and S1 area. So that's actually really in the lower back, and a lot of times it kind of spans across on both sides, kind of giving us that pain that runs across all the way in the low back. It can be nerve related, it can be disc related. So just to kind of give us an idea, the disc sits way down in there. You see all these nerves that are coming out of it. Those can get irritated, so I actually like to put ice if you wanted to stick to one or the other, and if you only had 10 or 15 minutes, I would do ice if it was right on kind of the spiny area, just because ice can only go down so low, and you have a better chance of kind of getting to where the root of the inflammation is. A lot of times the root of the inflammation sits in these intervertebral foramen. Heck, even the bony joints can be tender, and there can be inflammation in there. So I like ice if you wanted to use a modality to address the low back pain. But I also, for those of you that like heat, I think you've got to respect the fact that sometimes your body just works well with different types of modalities. There's quite a bit of people that respond really well to heat, but I would put it in a different location. I would put the heat kind of on the lower outsides. Even if you have pain right here, where X marks the spot and it kind of runs across, I find myself getting a lot of relief to clients if I address their myofascial tissue deficits and kind of the outer borders. So the muscles that are usually responsible, it can even be the obliques that you see there, but even kind of getting into the lower, deeper muscles, like the quadratus lumborum, it tends to be a key muscle that often causes a lot of pain, or even the muscles that kind of insert right in this kind of brim area on the outskirts of that iliac crest there. Heat can be incredibly helpful for that too. It's not a forbidden sin that you can't do both or you can't do any of them, but if you had to kind of choose, I would say let's put ice, just to kind of summarize, I would put ice kind of right on the lower back, right along kind of the spinous processes and right where the nerves come out, where the disc can be herniated and irritated and you can have inflammation. If you wanted to use heat, I would put it on the outsides, kind of towards more of the muscles to kind of help loosen the muscles up, get some more blood flow, and to decrease that too. So I hope that answers your questions. Thank you guys so much for tuning in.